A good morning to everyone listening in. I welcome you to Mr. Selfcare this Sunday, and we are going to talk about something very important. We are going to talk about a problem that many of you have been asking me about, and this is something to do with depression. Now, like we are going to understand, many mothers or women, when they give birth, there is normally a change in behavior or a change in the way they've been doing things. And most of the time, if this is not handled, they end up with the total behavior change that many husbands fail or take long to understand. Normally, motherhood is often pictured as a season of joy, and we expect that when mothers give birth, this should be a season of joy and happiness and celebration with love. But many of these women these days after childbirth, there is some bit of reality in changes or in behavior that normally sets in. Some of them feel overwhelmed by ambition. Some of them end up becoming sad. Some of them are filled with anxiety, or some of them even disconnect from their babies. Now, this brings a challenge to both the mother and the husband or the family members. Today, we are joined by one of my best friends from Lubaga, that is Mr. Kasozi, who will be introducing himself later. And we want to break down this silence on this topic that many women unknowingly or knowingly are suffering, but little know what they are supposed to do. Or many husbands are going through these kind of challenges, but most of them don't know what they are supposed to do. Mr. Kasozi, good morning.
Good morning, sir, and good morning to everyone who is live on. So today I'm by names of Kasozi Brian, a
Yes,
clinical psychiatrist from Rubago
yes,
Hospital. That's where I normally work from.
yes,
Today's topic being postpartum depression. I think in women.
yes.
We are going to talk more, and I also would love to share. Also to share from you people. Don't I'm going to be giving you what I know or what I have.
Okay.
Yes, you're all
Uh,
welcome.
Mr. Kasozi, I kindly ask you to extend a little bit on the other side. Exactly, yes. Uh,
Mm,
Mr. Kasozi, can you help us to understand
yes, sir.
what is postpartum depression? And also, there is something that we call baby blues. Can
Baby
you help
blues.
us to understand what postpartum depression is and how
Mm.
different is it from baby blues?
Baby blues. I think that is the period for the first time mothers. The period after birth. That is after 2 weeks. So normally these baby blues happens to mothers who have just given birth after 2 weeks, whereby they experience mood changes, they become irritable, others face anxiety, there is that kind of fatigue. Majorly, those changes that normally affect women who have just given birth, but in the period of 2 weeks. So they normally face these symptoms of feeling anxious, being irritable, being agitated towards their husbands. They normally have that mood, that sad mood, change in sleep, appetite, because they have a new person they are going to be caring. Okay, it's like they have given birth, but now they are entering into a new life whereby now they have got someone whom they are going to be caring of, taking care of everything, providing food. Uh, just like you are entering into a new life whereby you have someone you have to be constantly taking care of. Now, baby blues happens when, for example, using new mothers just who have just conceived, given birth, so they are welcoming a new person into their life. So they normally face these changes of life, from being from being one person to again having another person they have to be taken care of. So they normally face these early symptoms of being restless, having fear, tearing. Others also face the symptoms of feeling fatigue, worry. So they are ever worried, how will I be able to take care of someone? So they have been in the past, before they were being taken, they were able to care about themselves. But they have now another person in life they have to be caring of. Normally, these baby blues, for them, they normally resolve on their own after a period of 2 weeks. But when they persist for more than 2 weeks, now we enter into what we call postpartum depression. Postpartum depression normally, as the word postpartum. Postpartum, it means a period after giving birth, and it's normally a period of six months. After that period, it's no longer postpartum. But with depression, that is a persistent sad mood, changes in the mood major. Someone may lose his interest. There is tearing, fatigue, changing appetite and sleep. Others experience poor concentration. Others may also get these bad thoughts, for example, having suicidal tendencies and ideations. Others also go to the extent also harming the baby they are having. Now, with the baby blues, for as I've said, for baby blues, for normally for it does what? It resolves on its own after that period of 2 weeks. But if it persists, then it goes beyond the 2 weeks. So we are entering into what we call postpartum depression. Is it okay also I change into Luganda as well, sir? Okay. Mu kiseera omukyala yenna ng'afunye omwana asooka, kengeza abo bamadha ng'omukyala yakafuna omwana we asooka mu bulamu. Mu biseera ebisinga mu nnaku zino ezisooka, mu wiikisi ebbiri ezisooka, abakyala bano bafuna okukyuka mu mbeera yaabwe, okugeza nti wali ng'atannazaala omuntu abeera omu nga talina kyeyeeraliikirira. So ebiseera ebisinga tebafuna buzibu nnyo, kuba omuntu ng'obadde omanyiridde kubeera wekka, omuntu atera nnyo okufuna buzibu okukola ki? Okwerabirira. Naye kati wamala okuzaala ng'alina omulamu obulala bw'aleeta mu nsi, ng'ate bw'aba abuleese tekikoma kukoma nti nno agenda kubeera nga omwana oyo alyawo. Afuna n'emirimu emirala, nti omwana ono yagenda okuba nga amulabirira. Jjukira omwana ono ye talina kyasobola kwekolera. Kati mu biseera bino omukyala ng'amaze okuzaala, abamu beetandika okufuna okweraliikirira, n'agamba naye luli mbadde mbeera nzekka, naye kati ngenda kutandika okulabirira omuntu ono. Jjukira omwana gw'ogenda okuba omuyonsa, omulabirira, omukuuma. Kati abakyala abasinga batera okufuna okutya okwo mu wiikisi ezisooka ezebbiri. Muntu yenna yenna kya butonde, omuntu yenna yenna waba afunye ekintu kyonna kyonna, mu mbeera ze zikola ki? Bikyuka. So mu biseera ebisinga mu wiikisi ebbiri ezisooka, abakyala bano bonna bafuna okutya. Ebiseera ebisinga bagenda mu kubeera mu kweraliikirira, omwana ono wasinga ndwalako. Abasinga batandika okubeera awo, ennaku watuuka nnyo n'asoberwa, abamu bakaaba, ogenda omulaba ng'omubuuza okaabira ki? Nti neeraliikirira omwana ono, ekyokulya bannaye ate nina okumulabirira. So n'akubamu ebifaananyi biri eri, n'addamu n'azzaayo akatambi emabega, n'agamba singa nduyisa alina mwana, singa kati nkola kyange, singa ndi bintu byange, naye kati ng'alina omuntu gw'akola ki? Gw'alabirira. Ebiseera ebisinga abamu banyiigira n'abaami bwabwe, kuba baba bafuna kye tuyita akasunguyira. Buli kiseera baba bakambwe, banyiivu, olw'ensonga era emirimu gino egy'omwana egikoze eki? Egimwongeddwako. Naye nga bwe nkugambye, ekyo kye bayita baby blues kibeerawo. Baby blues kyeyo period wakeka akaseera ng'omuntu yakazaala ne wayita wiikisi bbiri. So abamu bafuna okukyuka mu mbeera zaabwe, abamu baba banyiikaavu, abamu baba bakambwe, bayomba, buntu butono nnyo bubakuulako waya. Naye postpartum depression kyo kibeerawo nga wayisinga baby blues. Obubonero buli bwe tulabe mu baby blues obw'okunyiiga, okukyuka mu nneeyisa, mu mbeera, n'okuwulira engeri omuntu gy'awulira munda nga ye oba muba banyiikaavu. Singa ebbanga eryo erya wiikisi 2 liyitawo ne tutandika okuyingira mu wiikisi endala, awo tugenda mu kintu ekiyitibwa postpartum depression. Naye mu kumenyaamenya mu postpartum omukyala ng'amaze okuzaala, ako akaseera ak'emyezi 6 ke bayita postpartum period. Then depression yeyo embeera ey'okubeera mu nnyiike esukkiridde nga buli kiseera weeraliikirira. Embeera awo ng'oli mu nnyiikaavu, amaanyi tolina, abamu balwawo n'okuzuukuka, abamu bakyusa ne mu nneeyisa, abamu baba bakambwe, abamu banyiiga, abamu batandika n'okufuna ebirowoozo ebikyamu okugeza ayinza okunyiiga ne yeesala oba si kyekyo omwana n'agaana omulabirira oba n'omwana n'omunnyini okukola ki? Okumutuusaako obulabe. Onkitegedde ssebo? Kati
So yes, Mr. Brian.
Yes,
thank you so much for this thorough explanation, helping us to understand baby blues. To everyone listening in, it simply means that actually when women give birth to their first child, first of all, they get baby blues because now this is unexpected load of work added onto their life. I think they start comparing their lives before pregnancy and after pregnancy. But Mr. Brian is helping us understand that if this persists, then it goes into what we call postpartum depression. And for people that are watching who are underestimating this effect, postpartum depression affects millions of women in the world. Unfortunately, most women do not know or do not realize what they are going through. So you could be a husband there, oli mwami eyo omukyala tokyamutegeera. Omukyala bwe yamala okuzaala tokyamutegeera n'ogamba oba omukyala wange yabaaki, omukyala yali anjagala kata kyanjagala, omukyala akulabanga mutujju, ye buli wakutunuulira obwongo omugamba ono yantuusa ku kino, singa teyali ono maybe saafuna lubuto. Abakyala abamu bagenda mu maaso ne balowooza, some even women go ahead and think, maybe I'm suffering, for him he's enjoying something else. For him he can move, for him he's not breastfeeding anyone. So that leads to what we call those baby blues or postpartum depression. And so many women are going to discuss with us here today as we go of how they manage to go through, but also we are going to hear from the expert, Mr. Brian, on how we can handle this. Again, I welcome you to this page. If you're here for the very first time, I kindly ask you to subscribe, but above all, I want you to share this live with people, pregnant women, or people that are planning to get married, because at the end of the day, we don't know what people go through in this kind of situation. I've faced postpartum depression and the effect that almost led to ending of my marriage, because at one time I felt I was not needed in a home. That's why I took time to invite Mr. Brian, who is an expert in handling depressions, to help us understand. And I hope we have a fruitful discussion. If you're watching in right now, I kindly ask you this question. Have you ever experienced postpartum depression? Do you know someone that has ever experienced it? How did they handle it, and what effect do you think they had? Please, you can go to our comment section and leave and have a discussion with it. Yes, over to you, Mr. Brian. Okay. Mr. Brian, in Uganda, how common is postpartum depression since you work with these people? Like on average, how many mothers do you see that have this problem?
So far, I've experienced many, not as much, but at least I've come into contact with some few women. Around like 20, I've so far interfaced with them. But
Okay.
normally, these women don't know that they are having what? Postpartum depression, because some, like here in Uganda, very few people have some knowledge about mental illness. Some people think that postpartum mothers, that's not a mental condition or mental illness. That for them, some people are unaware about what? About these conditions that you do normally, because we have a lot of challenge of people stigmatizing such conditions. Some people think that it's about it's a myth that those are bad omens. So some people have that kind of what? Some people have such what concept. Mu bufunze kiri mu Uganda muno abantu tubafunyeeko abalina obuzibu obwo moso abakyala gye bazaalira naye lwakuba nti n'abantu mu Uganda muno mental illness abantu abasinga tebamanyi nti obulwadde bukola ki gye buli obwo bulwadde bw'emitwe ate abamu balowooza nti abakyala bweba afunye obwo buzibu tebiriiyo so mu Uganda obwo bulwadde gye buli naye lwakuba nti nno information oba obubaka obukwata ku bulwadde buno oba obuzibu buno obulwadde bw'emitwe buno bukyali wansi nnyo olw'ensonga abamu bakyakkiririza mu traditional ways abamu balowooza biba ddogo abamu balowooza babaloze so abantu bakyalina eyo endowooza naye ekituufu kiri nti abantu bano gye bali singa nnyo mu bakyala abakafuna omwana waabwe asooka mu bulamu kuba abasinga yaba amanyi nti okufuna essanyu nti no afunye omuntu okufuna essanyu ly'omwana naye abamu bamaliriza bafunye obuzibu buno ngera we nkugambye nti ennyiike ye depression mu luzungu naye ennyiike ne postpartum emyezi 6 omukyala ng'amaze okuzaala eryo ebbanga eriyitawo bafuniramu ekintu ekiyitibwa ennyiike olw'ensonga ojja kumbuuza ki ekikireeta ebikireeta tewali kyakimanyi naye bibeera bingi wabeerawo ebiyinza okukola ki okugireeta naye nga ekintu kyennyininyini kye bagamba nti kino kyekigireeta kyennyininyini nedde tewali yakoze eki yakizudde naye nga bintu bingi bye tusobola okugamba oba kino okugeza
Mr. Brian,
yes,
actually awe mbadde ngenda ogenda naye njagala I want to enlighten a story which was in Uganda's papers that I know.
Yes,
there is this couple that I know actually. The husband is a medical worker, works with one of the hospitals in Uganda, and a woman. This story was all over the news and actually social media, where this lady gave birth and she got postpartum depression, and the husband took her to one of the hospitals. Actually, I think Rubaga Hospital. Wow. This guy works in lab, and so all along he was explaining to the girl's family that this lady got postpartum depression. The family was saying, no, we've never had any mad person in our family. They refused. So the condition actually got worse. If you remember the story of Sharon in Natukunda and the Dr. Ankusa Richard in Uganda, because I was close to this family, I knew that she got postpartum depression. So instead, they took this lady for prayers in one of the churches around the Mulago there, and the situation escalated. One time she leaves the baby home, she starts to wander, to move around. And when this family realized that the guy didn't have the daughter, they went to Maulire, if you remember. Alabika yasaddaako omwana waffe, maybe sacrificed our child, and it was all over social media. You can Google and search about that. So the gentleman comes out to explain, this lady got postpartum depression. Now, for us who are close to this couple, we knew what she was suffering from. So to everyone that is underestimating the relevance of postpartum care or mental health, this is one example that we all know. It is not a secret because it was in papers. That's why I'm talking about it. So sometimes our women go to that level of actually trying to harm their children now. But now, doctors, you're trying to help us understand. What are some of the things that can escalate? Or, yes, we don't know the actual cause, but what are some of the things that may lead or may most likely trigger postpartum depression in women?
Okay. As I've said, the exact cause is unknown, but there are some predisposing factors. For example, if in the family there is positive history of people with depression, it's more likely that this person may suffer what postpartum depression after giving birth. You get? We have challenges of life. For example, if someone has given birth and he has lost these stressful events, for example, someone
Mm.
has lost a partner after giving birth. Someone will
Mm.
be stressed. We go through what we call grief, bereavement, all that. In
Mm.
the end, someone will end up becoming what? Depressed. You
Yes.
get? Then we
Mm.
have these, someone will also get what? Another factor that maybe would cause this is if someone is faced with, for example, I've talked of the history or positive history of people with depression in their family, stressful events, lack of support, for example, from the husband. There are those men that normally, after the wife giving or conceiving, I mean giving birth, they normally don't take what care. So they also, that one can lead for this young mother to become what this depressed. Another factor that maybe can cause this is these other conditions. For example, uh, medical conditions. For example, if someone had a tumor, you can never know. These people who were abusing drugs, you get, things like drug abuse can also lead to depression. Another thing that can cause that could be lack of family support. If the family abandons you, your real family that you gave birth to for that man, yet the man was never wanted in the family. Uchitegera. So another thing maybe what can cause that is it can just happen from nowhere. It can
Mm.
be when it is what? It is genetic, you get. Some
Mm.
chemical hormonal imbalances. For example, these women who after giving birth, they normally have what hormonal changes. For example, there are
Mm.
some hormones. For example, I don't know how to call them. I don't know how it's called in Uganda, but in English, I think there are two hormones: the progesterone and also the estrogen. Normally, after a woman giving birth, these hormones normally go down. So this can influence a mood change of the persons, leading what to depression. Mu bufunze ebintu bino etugawe nkunyonyodde nti depression oba
Yes.
ennyiike ekigireeta tekiwali n'omu akola ki akimanyi.
Achiman.
Naye waliwo sobola okugamba nti oba kino singa mu
Mm.
famire yammwe waliyo abantu baali bafunyeeko obuzibu buno obwaki obw'ennyiike, beera
Mm.
n'emikisa mingi nnyo nno naawe oyinza okukola ki okubifuna.
Okufuna ennyiike. Mm.
Yenyiike yesobola okujja omuntu nga yeekyayi n'abeera ennaku ennyingi ku mutima, n'ebiseera
Mm.
ebisinga abantu abalina ennyiike n'ebyokukola bye balina okukola mu mbeera y'obulamu tebakola ki babivaako. Then
Mm.
ekirala kyeggamye singa abeera n'omwami oba ng'afudde, nga tomanyi
Mm.
kisemwami sekyalo nayinza okweraliikirira. Then n'ekirala
Mm.
nga ssente teziriwo waka, obuyambi butono, nazo kiyinza oba omukyalo n'agenda kweraliikirira nti yiyi omwana kyagenda okulya atya n'akijja ate omukyala jjukira yakazaala talina, oba abamu baba tebalina na mirimu, so abamu beeraliikirira ti omwana
Mm.
ono gwendeese mulamu buno anaalya ki. Then n'ekirala kyeggamye singa famire y'omukyala omwami gwe yazaalamu nga naye tebakola ki nga tebamusiima munnaye. Ayinza okugamba fe
Mm.
omwana wo tetukoze eki tetumusiimye munnaye ojja mwerabirira. Ebiseera
Mm.
ebisinga abakyala bano basoberwa, okiraba.
Mm.
Era nekigamba abakyala bano babeera n'ebirungo mu mubiri.
Mm.
Ebirungo bino bisobola okuba biba bisse oba bikyuseemu, omuntu akyuka natural, akyuka mu
Mm.
ndowooza, ne batandika ne bafuna akasunguira n'okwekyawa. Then
Mm.
nkugambye waliwo n'ebizibu ebitalagwa, okugeza singa omuntu afa, okitegeera.
Mm.
Then abakyala bano abamu singa baali bakozesa ebiralagalalagala, okugeza omukyala yali munywi wa mwenge oba nga bakozesa zino enjaga, abamu balya n'amayirungi, so biyinza
N'emmindi.
okuleeteramu n'emmindi. Then
Mm.
waliyo n'eno myth nti abantu abamu tebakkiriza nti nno, abamu balowooza nti baba babaloze nga bongambye nti eyo famire yagenda
Mm.
mu kyaki nga bo balowooza nti ki babaloga naye ng'obulwadde kiki weebuliga amazima tebuvaawo wabajja kusabira naye obuzibu tebujja kukola ki tebujja kuvaawo n'ekirala ekisembayo kugambye nti abantu tuyinza okufuna ebizimba abantu tufuna ebizimba oba ne tufuna obulwadde nga buno obwa malaria n'atulinnya ku mutwe mulimu endwadde ezisobola okutuleetera okugeza okuba n'ebyo ebizimba nga wenkugambye omuntu ayinza okuba n'ekizimba then n'okufuna ebintu ebitukanga okugeza singa bukya omwami n'aba nga omulimu guweddewo nga tomanyi gye guvudde naye nakuteera ku makya n'agamba nkubuulira omulimu guweddewo abamu bayinza okufuna okutya kuba ajja kwebuuza ekyokulya tugenda kukijjawa so omuntu atuuka n'akola atya yeekyawa ekijja nga atandika okunyiisa mpola mpola bwatyo.
Again, today I've learned another word in Luganda. I've learned that depression is called enyiike. Probably John Neighbors and depression eba chiyita batya mu Luganda. So to everyone watching, a new word to learn from today's episode is depression mu Luganda gye bayita enyiike. So oli wagamba nti nina enyiike, it means they're having depression. But also number two, you've talked about a very important aspect that yes, sir.
A minute.
Yes.
Enyiike kitegeeza omuntu kintu kibeerawo lubeerera buli ssaawa obeera nakyo naye nsobola okugaa nti oya ndi munyiikaavu gy'oli naye kaseera naye enyiike kitegeeza nti every day it is there someone is sad loses his pleasurable activities that he does every day in the day life so for it is there every day almost every time it is persistent sadness and loss of interest in the pleasurable activities. So it's there almost every day. You wake up in the morning, you are sad and feeling bad, yeah? Then instead of you waking up and say, maybe let me prepare for my baby, what to eat, clean, do what, everything. You feel like you want to sleep every day, every time. You go to the extent of even isolating yourself from others. You feel like you don't want to associate with others. You feel like you want to do everything alone. At times, these people are normally what? They are tearing. Even their faces are showing that really someone is really sad. You can really tell. So when you ask them, how are you feeling? They will tell you, I'm feeling bad. Very, very bad. On their face, it will really be showing that you know someone is really what is feeling sad. You can go on, sir.
Again, what actually Mr. Brian is saying is very right, where we say sometimes the conditions that we subject these women to. Of late in Uganda, we are having a problem. There is a couple that is in the news everywhere that is split up recently. But if you look at the type of messages, the woman saying, oh, I wish the whole world knew you were beating me while you're pregnant. Now, imagine your wife is pregnant and you're beating her up. You get. So those are some of the things that are actually leading to this increasing depression every day. We need to, as men, to fight that. Your wife is pregnant, she's already going through a lot, and you're subjecting her to physical violence. The other thing is lack of preparations. Some of you just get pregnant. You've not prepared how you're going to take care of the child. You've not prepared. You've not prepared how you're going to take care of the child. You just making someone's daughter pregnant. You have no financial plan. You have no deliberate effort on how you're going to look after the child. These are some of the things that are actually bringing us depression. How do you beat a pregnant woman? How on earth do you beat a pregnant woman? Some of you men are abandoning your children. You make a girl pregnant, maybe because you found out with another message. You start as a sigenda labida mwana oyo paka ng'omuzadde. Why don't you first take care of the child, have the child produced, then maybe you go for DNA to confirm paternity. But the moment you have misunderstanding, sigenda labida mwana. This girl is pregnant. So men, we should be responsible. The issue of support is very, very important. Of late, so many women are coming out to say their husbands actually beat them while they were pregnant. These are some of the things that are eventually cause baby blues and the postpartum depression. Mr. Brian, what are
Yes, sir.
some of the symptoms that women or mothers should look out for that could help
Oh,
them
yes.
tell if they are being depressed?
Like I said earlier, one of the common symptoms of postpartum depression is someone will present with persistent sadness.
Hmm.
The persistent sad mood will be there almost every day.
Yes.
Someone who used to do her daily activities in the morning, he will lose the interest. So he will no longer be doing the activities that he used to do on daily basis. Another thing, normally with these postpartum depressed women, they will be tearing every day. They will feel like they want to associate alone. They will isolate. Another thing, they will be with low energy every time they are feeling weak. Their concentration and attention will be down. Others will face a problem with the fatigue. They will be tired every day. They will have heart palpitation. Their heart beatings will be beating at a high speed. They will be like having a racing heart. The heart will be beating so fast because they will be also worried. They will feel like they will feel like they are lonely. They will have thoughts of feeling worthless, hopelessness. Uh, at times also they get some bad thoughts. For example,
Mm.
self-harming themselves. Others,
Mm.
those are the people whom you hear who have committed suicide.
Mm.
They have hanged themselves, or they're harming the baby. You get. Others will feel like they will not be caring for their baby. They will abandon the baby because they are no longer interested. They will have changes in their appetite. For example, they will either eat too much or eat less. Others will be having too much sleep, or others they will feel to get the sleep or and maintain it. Others they will also change. They will start having hallucination. Hallucination is whereby someone, there are these misperception, misconception, mis no hallucinations. They are like misconception of the external stimuli. For example, someone will be there and feel like, there's someone who has touched me in the absence of a stimuli. You get someone who feel like there is someone touching, or things are walking all over the skin, but on asking where are they, someone cannot explain. Others will feel that they will get that moment whereby they will feel like they are hearing people talking or calling their names, but on looking, none to see. Others have change in smell, change in the personalization. For example, someone will feel like they have changed themselves. That is personalization, changing their reality. Others must also feel like they're having illusions. Illusion, for example, you can be there, then you misinterpret a belt and call it a snake, because others also get these delusions. Delusions like some false fixed beliefs that they are not specific to, they are only specific to you, because some cultures have their own way of doing things, but these things are false beliefs. They are unique to you, but they are not unique to others. For example, someone may have delusions. They are less common in depression, but they may feel like, for example, the nihilistic delusion whereby someone feel like one of their things they are rotting. For example, someone may be there and tells you that, my stomach is rotting. I have maggots in my stomach. You get things that they are not really existing. Mu bufunze, postpartum depression oba obubonero k'osobola okulabira omuntu ayina obuzibu buno obubonero okulabira omuntu alina obuzibu bwa postpartum ng'amaze okuzaala, ebiseera ebisinga baba banyiikaavu, babeera n'ennyiike nnyingi nga beekyaye, so times asobola n'okukaaba naye nga tomanyi maziga gye gava, n'omubuuza okaabira ki, naye n'omulaba ng'akola ki, ng'akaaba. Ebiseera ebisinga abantu bano baba bakoowe, ebiseera ebisinga basiiba nnyo ng'ali awo talina kyasobola kukola, abamu n'okunaaba babyerabira nga obuzibu buno bubadde ki, nga bubadde all that severe. Naye n'ekirala abasinga kugamba mpulira entunnunsi zikola ki, zinkuba nnyo. Abalala babeera mu mbeera yakutya nakweraliikirira. Omuntu abeddewo abamu bafuna n'akugamba nze sina ssuubi. Abamu batuuka ku mbeera nti nno n'awulira ng'ayagala beera yekka nga awulira talina kintu kirala ky'ayagala kukola. Abamu beesibira mu nju, abamu abakyala bano batuuka ekiseera n'abaana, omwana gw'azadde naye nga takyajjukira nti oba alina n'omwana gw'alina okukola ki, okulabirira. Ebiseera ebisinga abantu bano bafunamu n'enkyukakyuka mu kulya kwabwe. Abamu balya nnyo oba abamu ne balya kitono nnyo oba n'obutaliira ddala, so bakyufu bafuna enkyuka mu kulya. Kyekimu n'okwebaka, abamu ajja kubanga mwebakuse nnyo nga amala essaawa nnyingi nnyo nga yeebase, then n'ekiseera oba n'amala nga tafuniddeeko ddala kinaganza otulo tombuze. Abamu batandika okufuna embeera ey'okwejja mu bulamu bw'ensi eno, batandika okufuna ebirowoozo ebibi. Ayinza okwetuusaako obulabe nga ye, oba obulabe n'abutuusa ku ki, mwana. Abamu batuuka mu mbeera n'ey'okunywa omwenge, ey'okukozesa ebiralagalagala, nti wanaakozesa bino ebiralagalagala okugeza nga omwenge. Abamu batandika okunywa sigala nti ebirowoozo bigende, naye ebirowoozo bino tebikola ki, tebivaawo ng'ebiralagalagala bino bimaze okukola ki, okumuvaako oba nga n'omwenge gumuweddeko. Abamu batandika okufuna embeera y'okugamba nti afudde asinga, batuuka mu mbeera ey'okwekyayira ddala. Abamu baba bakambwe na nnyo eri abaami baabwe, nti kantu katono nnyo kamuggyako n'akuvuma. Abamu ne batandika nakugyamu ki, luyombo, onfuna ssebo. Abamu batuuka mu kiseera ey'okubeera nti nno batandika n'okufuna embeera y'okuba nga abamu bawulira ng'abantu ababayita, abamu batandika okuwulira obuntu obubatambula ku mubiri gyabwe. Abamu bafuna n'embeera ey'okugamba nti, okugeza omuntu ayinza okubeerawo n'agamba naye nga mpulira nga ebyendi atalina, tetulina delusions. Delusions simanyi bwe bakiyita mu Luganda, naye mu Luzungu omuntu ayinza okubeerawo n'agamba mpulira nga ebyenda byange bivunda, oba n'agamba mpulira nga n'omukono oguvuddeko, n'awulira ddala kumbe nga gw'omukono oba gubadde gukoze ki, gusanyaladde busanyalaze. Ayinza okugamba siguwulira, teguliiko, okitegeera. Oba n'agamba ntambula naye omutwe teguliiko, onfuna. N'agamba oba n'akutuka n'agamba nze gw'olaba wano eno si nze aliwo, omuntu mulala yaki yaliwo. So abantu abamu bayinza okufuna embeera eyo. So kwe bw'oba obubonero omuntu kw'olabira nti omuntu ono tandise okuyingira mu kitwandiise postpartum depression, oba obubonero obulabika ng'omukyala wayise ebbanga ng'azadde, oba mu mbeera y'okwekyawa ng'amaze okuzaala.
Yes. And again, for people that have just joined us today, we are handling postpartum depression. This is the depression that so many women get after giving birth. And Mr. Brian has really explained it very well, starting with baby blues, which is say that normally mothers experience because now the baby is like another person added into his or her life, that she didn't plan like to have. It's like extra stress. And then he's gone ahead to explain postpartum depression. And the conversation is really interesting. One of the things I've personally seen women close to me do, or my sisters, or those within my circles do, there is always that hatred for the baby. Omukyala atuuka nga takyayagala mwana. Omukyala n'atuuka nga tayagala kuyonsa mwana. Most times we bana abakyala betusanga n'azaala omwana naye nga tatambulako na mwana yadde nga n'ekyalo people even don't know this person ever gave birth. Ng'omukyala tatambula na mwana yadde naye ng'omwana yakamuzaala amuleka waka n'amulekera maidi neyekwasa obusongasonga. Some of them are having postpartum depression. No, omukyala n'aba n'omwana naye ng'omwana akaaba olwo bwe yagenda ng'omwana akaaba
Satamufa.
nga ffena tumuwulira naye nga yagamba tamuwulira nti akaaba. Many
Mu
these
luzungu kye
women,
bayita abandoning.
okay, so
Mu
most of
luzungu
these
bakiyita
women,
abandoning. N'abanga
okay,
takyamufaako muleka awamu bamulekera n'abantu. Kati kenkubulireko example mu gye nafunye. Nabadde mu community oba endeeba owulirayo.
Ndeeba mmanyiyo.
Endeeba eyo waliyo akafo kali awo kali almost a slum area, though it is in town. Now we happen to we normally go and give out some outreach services, for example, more so in medical as well. We cover a lot. Those
Yes.
complicated cases we normally refer, but these minor ones we normally handle them at a lower level. But
Yes.
now I came in contact with I don't know I think some good person who picked up this baby, that the
Yes.
mother just abandoned the baby. He called her that, could you help me with some few minutes to hold my baby? I'm going to buy some drinking water. And certainly the mother did not return. And since now, the mother has never returned. But the baby is healthy. So now assessing and questioning the caretaker, the one who picked up the baby, was like, no, ever since the mother left, has never returned. And they went to the police and maybe they gave up some details they reported about the incidents. But ever since then, the mother has never returned back. And it is true that the child is around 3 months. And it's just within that period I've just explained. That it exists between the day when you give birth up to the period of 6 months, and this child is 3 months. So ever since that the mother left the child, but on assessing according to those who were close to her before the child was dumped, they reported that this mother was ever crying, feeling sad. She never even had the urge to take care of the baby. And I think maybe she got pregnant unwillingly. You know, with our kind of life we are in, it's kind of a stressing life. So maybe she might have gotten pregnant and she never wanted the what? The pregnant, sorry, and she feared to do what? To abort. And maybe after giving birth, she said, okay, let me just have the baby. They will care. Any good heart people maybe will take care of the what? Of the child.
Yes.
But
Again, actually,
one.
Yes. Again, also
It's
one
true.
thing.
I'm not saying that maybe it's after showing you or for making the presentation more joyful. No, it's
No,
reality.
Brian, I've
It's
also seen.
reality. I've faced it once.
I've also seen actually women a woman who was beating ngaluma omwana we.
Yeah, it does. And
Yes,
by the way, it is also
actually,
but that one it normally exists when like after birth. That is what we call preparopsychosis. Preparopsychosis, immediately the mother gives birth, that thing comes in. You will find a mother when is really biting the child. So someone becomes psychotic, starts
yes,
thinking in the opposite way than the normal life.
Brian, as we
Yes,
continue, let's talk about emotional and social support. Why do mothers always suffer in silence instead of seeking help?
Wow. Now, as you know, the traditional African way of life, normally
Yes.
it's very hard for a woman. It's only a very few will come out to talk about the problems they are facing. But normally they say omukyala alina kuguma buli kimu, abamu batya okwogera. They fear to. Some women have low self-esteem, so they can't come out and share what they are going through because they fear how the public will judge them. You get. Normally, in African traditional society, people fear or they have low self-esteem. And also some backgrounds where you come from. Our in-laws, So how can you just come? They will ever tell you that when I was bringing up my son, did I call
Yes.
you to come
No.
and give it a hand? So also do
Okay.
the same. So another level, this perspective of that you should go through what I also went through. You get. So abantu kale mu buwanga bwaffe no mu Afirika moso mu batuzaalira abaami era Nazaala ajja kugamba kuzaaba bo kuba nange ate kino kyonkirabyeko. Nazaala omuntu ogendayo nti akuyamba akugamba kuzaaba bo nange abange nabeekuliza kati lwaki tokuzaaba bo? Era omu naleka amugamba kati enkoko olaba ekuza abaana baayo ate gw'olwo omuntu okitegeera. So ate n'abalala batya okwennyonnyola abamu balina ekyo nti nja kuswala banandaba batya okitegeera. Ekintu kino n'ofa n'obulungi ate nga omuntu maybe ng'osanga omuntu oba yandikuyambye naye abantu abamu bafa batya okwennyonnyolako okweyogerako ekizibu ky'alina okitegeera. N'ekirala abakyala abasinga bazaala abato muno mu Afirika. Naliko emulago eyo nensanga nazaalisaako omwana eyo emulago nga nkyali mu training. In fact na Kirudu yali Kirudu, yes no Kawempe. Abakyala abasinga kati bazaalira Kawempe eyo governmental facility, but at 19 was already has 5 kids, which means yatandika okuzaala at 15.
Wow.
And we twali tumuzaalisa yali azaala set yakubiri ey'abalongo. Okitegeera sente tewali kati musente obutabeerawo azaalidde mu gavumenti kuba nabirabanga embeera yo ndalamu. Kati omuntu oyo tomusuubira kubeera ng'ali bulungi mu birowoozo, ajja kuba yeeraliikirira. Kati ate n'akugamba ye waddayo ewaka atandika okukola emirimu omusajja tamuyamba oba onfuna. Emirimu gino wagikola buli kimu kwegamba omusajja amulaga nti no is the king, ye talina kyakola. Kati wabeera nti no amulaze nti is the king, of course tolina kyogenda mukolera. Ku mukazi ono agenda kubeera nga buli kimu akikola, agenda kutuuka afuna embeera y'okwekyawa awulire ng'akooye. Wanaakoowa ye postpartum depression gye tugenda okugendamu.
Yes, Brian. Though you've said that in our women, especially local women, but I've also seen postpartum depression in highly educated women, which I think sometimes I would say that women actually don't know. We are still not paying enough attention to mental health. Now, that takes me to the next question, Brian.
How does highly educated?
Yes.
A minute. Highly educated wetufunira we wano nti bo beetwala nti no they know a lot okitegeera ne beerabira nti no ate kigendera naye mukwatirayo watya nti kati bino bigenda kujja kuba because bo batulaga nti they know a lot, abamu bagenda kugugera kati challenge ndala gyenfuna nga tujjanjaba bano abalwadde aba bali highly ajja nga agogolinze ebintu ebimu ng'abirina ku fingertip. Nagamba musawo ekyo kyongambye siwe kiyina okuba olimba kale n'omubuuza gw'osinzidde essimu endaga kino so kuba kugugogo buli omu ateekayo kyayagala siwe kiri.
Exactly.
Naye kati oli ajja nga mind ye eri fixed okitegeera kuba yakulaga nti yasomye ate kati ayagala almost mubeere ku level y'emu gwe jjukira wakitraining okumala ebbanga kati ate ye akisomye mu ssaawa emu naye agala mubeere ku level emu bwoti. Kati abalwadde ng'abo kye tukola omunnyonnyola ekituufu, bati abamu balwawo nnyo okutegeerera omuleka kimala mukwata n'akola atya n'akomaawo naye nanga ndowooza musawo ndowooza kyawadde oŋŋamba maybe kyawadde kituufu ndowooza kati nzikiriza era mulwadde ng'oyo abo b'oŋŋambye abali high educated tomukaayanya kuba mugenda kusulawo osooka n'omuleka n'amala okwekoona n'akola ki n'akomaawo naye nga mu kusooka omubulira ekituufu lwakuba nti no argument ye abamu babijjamu aga omutwala nga ataakola ki ataasoma but nga mu reality esigalayo nti no aba eyo point mweyo mulayini abeera ne knowledge deficit oba abeera ne knowledge gap. Nfunye ssebo.
Okay, so Again, to people watching in, we are discussing postpartum depression, and the discussion is really getting interesting. I think I got my type of person. Uh, we are speaking at the same wavelength. I am really enjoying Mr. Brandes. Again, to our patients who come, who read things from social media, these search engines that I won't mention, Google, GPT, and all those, and you get medical information. Every medical condition is different. Before a doctor gives you any medicine, we all know the drugs may be for painkillers, but before I give you a painkiller, there are so many other things I need to find about you. Sometimes the information you're reading is old or outdated. Sometimes the information is true to a certain race of people. It works in the black people, but does not work in the white people. Did you know that almost all the lab values today, the ones that maybe work in Asia, on the Asians, are not true for black people, are not true for Europeans, are not true for Americans. So if for you just go to Google and put in something, you're going to read about something that is true in Asia, but not true in Uganda where you are. So what am I saying? Give medical doctors a chance to examine you. I used to face the same while at Mulago Hospital. You're trying to tell someone, and a woman is trying to challenge you. And I always give them some time to calm down, try to explain to them. And especially on infections. I was reading, this is Candida, because I'm having itching, I'm having this. And you look at them and you smile back, and in your head, you're like, oh my, oh my. So again, to our educated patients, you're educated in all the other things, but not in health matters. These people went to school to study the things that you're complaining about. And this is where actually we've come with drug abuse. You assume you have a disease, you even go ahead to go to the pharmacy or drug shop to treat yourself. And before you know it, you're wasting money, you're making the disease progress to complicated stages when you're not getting any help. This has led to chronic things like chronic infection, chronic candida, because you're misdiagnosing yourself and mistreating yourself. So again, on this page, we say that not even the information we share on this page is true. Go to your health professional, listen to them. Don't base even on information you're hearing from us to resist help from your profession. Don't say, I was watching Mr.Selfcare and Mr. Kasoza, and they said, if I have this, this is. No. Listen to your doctors because they see more on you physically than we are able to. Mr. Kasozi, how does
Yes, sir.
this postpartum depression affect the relationship between the mother and the child, but also with the other family members?
Of course, as I've said, someone who is depressed is going to isolate himself. The husband, the child, and the wife, together with other family members, none will understand the other. So there is a possibility of what? Of separation, hatred, yeah? Because now, if you are coming to someone who's already depressed, he will not be responding to you. So you will find out, you maybe think that he doesn't want to respond to you. You will leave when you are feeling bad. Yeah, you are going to have all bad thoughts towards this someone who is depressed because he's not responding to you. To the husband of that depressed mother, of course, there are going to be fights and arguments. Yeah? You are talking to someone is agitated, restless, yeah? Aggressive. They also lead to gender-based violence. Of course, someone will be fighting. The man will want to have his respect as a man in the family, and this mother will also be depressed and agitated. Of course, there we are going to have gender-based violence, whereby we are going to have the fightings, killings, whatever, injuries. So to the baby again, this baby is not going to get the tender care that's supposed to get. This child will not have will not get enough feeds because now the mother is depressed. Will you be able to come and be preparing the food and give the baby in time? No. To their family members or the in-laws, of course there will be what, as I said, someone is having a sad mood, is no longer interested in you. Yeah? You see, they are going to get some quarrels and arguments with the in-laws. So
mm,
it will cause a lot of course because no one will be understanding the other. The
mm,
depressed person will be in his or her own world. You get
mm,
together with these other members. So of
mm,
course there will be no unity. There will be no unity. There are going to be quarrels. There are going to be fights in the family. The baby might also get other diseases related to due to deprivement of the feeds. When this child grows up, the brain is going to be traumatized. These are the
mm,
kids who are going to grow up with the autism. You know autism,
mm,
separation. There are going to be also some separation what attachments, which will affect the baby negatively. There will be no bond. Mother-child
mm.
bond will not be there. Yeah, it's
Um,
causing a lot.
yes, again, to fellow men watching in, this is actually this episode is really important to men. Why? We need to understand that actually this woman is going through a phase in her life. She does not need rejection, but rather understanding. I believe
Exactly.
most of you have heard of a man complaining that after this woman giving birth, she turned all the attention away from me to her baby. Bwe yamala okuzaala nze yanvaako. The in-laws think she's now proud because she has
Mm.
given birth to a baby boy. They don't know this woman is actually suffering from a depression, that either she's developing too much love or less love for the baby and the people around her. The maids at home think this madam is now not understandable. She became so lowly and things like that. This is why such conversations now are important in this generation to understand that this woman has not developed bad manners. No, she's going through a depression and needs everyone's support and understanding. And with the proper management and care, with experts that are knowledgeable with mental health illnesses, this woman can always recover. But without proper care, normally these families are going to separate. I've heard of stories where it is believed that men actually, most of them cheat on their women. Not all of them, but majority of men who cheat on their women, they will also do so in this period. A man feels he's not valued anymore, is not wanted at home.
Mm.
He feels the woman now only loves the child. Most of them now seek consolence, or they are going to seek comfort
And
outside. And this has
and
led to,
it's
mm,
during this period when a man also starts boozing substances,
yes,
because for him what he's expecting to get at home,
mm,
there is no communication. So this
yes,
man that is the time when he goes out to start
mm,
boozing, do all bad activities with the rest, with the bad peers, of course,
mm,
because there is some problem at home of the depressed mother. Some even the mother will develop much love for the kid during this
mm.
period. So the man will feel like is left in that space. No one to take care of him. So that's the period when most men do what? Go out also cheat, booze, do develop all bad behaviors during that period because the man has failed to understand what the woman is going through.
Uh, Now that we've understood the signs, symptoms, and actually the effect on the family, Mr. Brown, let's talk about the
Mm.
treatment and supportive options that are possible. What are some of the treatment or
So
support options that are available for mothers that are undergoing through PPD or postpartum depression?
after like I've said, after doing your assessment, you found out those after knowing those symptoms
Mm,
from the mother, he has told you what is having or experiencing. Again, we are going to do a thorough assessment,
mm,
proper history taking of this person, how his
mm,
life has been, what is she going through. That is
mm,
through proper history taking. Then
mm,
after taking the history, you go ahead and examine this person. How?
mm,
You are going to carry out a mental assessment.
mm,
You get? You are going to do some investigations to rule out if there is any cause. You
mm,
get? You are going to, as I've said, under
yes,
assessment, you are going to take
mm,
assessment. You are going to do a psychiatric assessment. We are going to do
mm,
a medical assessment. We are going to
mm,
do family history. How they
mm,
have been. Which medication could this patient be having? Which chronic condition you get? You are
mm,
going to do a mental assessment. You are going to assess this person mentally, eh?
mm,
Which means you are going to do a proper clerkship.
mm,
Hmm? Then after doing all that, I've said you are
mm,
going to do a psychiatric assessment, you are going to do a mental assessment, taking
mm,
the family history, medical history, all that.
mm,
After doing that, we are going to do also do some simple investigation. For example, you can do a blood what? A full blood count to rule out any
mm,
chronic illness or any infection, anything that related to the blood.
mm,
You can do a CBC. By the way, I aware that some women you can do some investigation. For example, the liver and the kidney investigation, and you find out maybe it was due to electrolyte imbalances. You can also do hormonal checkups. You see if there is some hormone that is really doing what that's not enough in the body. Then afterward, you can do also
mm,
these image scans. For example, you can do a brain CT.
mm,
Might find out that you will know what this maybe a tumor. Also,
mm,
you can rule out if there is the mother is having what I've said, the brain CT. You can rule out those tumors, blood vessels, the enlargement of those blood vessels. If there is a clot, if there
mm,
is an infarct, or those brain infarcts, for example, you might find out that she's having a clot somewhere, or
mm,
there is some cells that of the brain that have done what have died out.
mm,
You can do also an MRI. So
mm,
that's a simple investigation you can do to find out.
mm.
But the major one is doing a thorough history taking and proper assessment.
So, so Mr. Brian, after that is done and you confirm that this woman has PPD or postpartum depression, what do you do for them?
What we do for them, medication comes in as a second option, but the first thing is psychotherapy.
Okay.
Psychotherapy, you first educate the mother that you know what? That is psychoeducation you first give. That
Mm,
you are not the first person to give, but normally many people have experienced it. This you let her know what she's really going through. Then you can
mm,
also give this mother what we call supportive psychotherapy. For example, you can teach this mother the relaxation exercises, these breathing
mm,
exercises whenever she's interfaced with such what symptoms.
mm,
We can also support this mother through psychotherapy. For example, cognitive behavior therapy. Sorry, under
mm,
cognitive behavior therapy, we are teaching this mother that we are
mm,
changing the thinking, we are changing the irrational thinking to rational.
mm,
Like what is happening through you, we can change it into better things. For example, what has caused you to start worrying? You get, so there you are
mm,
changing the cognitive sphere of this person, that
mm,
start thinking positive, do not think negative. If the
mm,
husband is treating you like this, there are other people who can treat you welcome you better, and maybe you are changing the perception and the thinking. You get,
mm,
still under psychotherapy, you can also teach this mother under behavior therapy. Behavior therapy, it's like you are changing behavior this the behavior of this mother,
mm,
that if you've been like treating or responding badly to people, you can change your behavior, maybe be nice. It's like you are
mm,
changing his way of life in the environment which she's living in. So
mm,
maybe you add such that she can adapt the better behavior. Mubufunze. tusobola okujjanjabisa engeri nnyingi. Tusobola okubuulira omukyalo ono ne tumubuulira ebigenda mu maaso mu bulamu bwe. Ne tumugamba noono naye yali akibaddeko. Mu bufunze tusobola n'okufunayo other supporting groups omukugamba ne tumulaga abakyala abalala banne abali mu mbeera eyo abayise mu mbeera eyo. Tetumubuulira n'okumubuulira nti obuzibu buno mu butuufu abakyala abamu bakola ki batera okubufuna naye bwe bubabuze tusobola okukola bwe tutyo okugeza nti omukyalo ono tumubuulire engeri y'okwekakkanyamu ya ngeri njawulo. Waliyo okutuulaawo n'okkakkana n'osooka n'okkakkana ng'embeera eyo ze n'otabeerako kintu kyonna ky'okola n'osooka n'oweewuulirira nga ggwe kye bayita self meditation, okwebuulirira n'okkakkana. Then tulina ne kino bye twali tukolanga mu PE bino eby'okusika omukka n'ogukwata mu kifuba then n'omala n'okola otya n'ogutta nga wayisa akaseera akatono. Tuyita breathing exercises, kwegamba buli w'otuuka mu mbeera y'owulira nti osobeddwa osobola okukola okuba ng'osika omukka guno. Ekituyamba okusika omukka guno okugukwata n'okugufulumya nti kituyamba okukkakkanya ebirowoozo. Ti omuntu abadde atandise okufuna okutya nti omutima gukuba nnyo, olaba w'osika omukka guno n'ogukwata n'omala n'ogutta n'ogufulumya mpola nti muli otoolokoka ebirowoozo bitandika okuddukuta obadde atandise okubeera okweraliikirira kuba omutima guba gukuba nnyo n'okkakkana. Eri ne nkugamba n'okugamba tulina engeri gy'okujjanjaba abantu bano nga tubabuulirira okugeza otandika omukyusa engeri gy'abadde alowooza ey'embeera nti afuna ebirowoozo ebibi n'otandika okumubuulira akyuse endowooza abadde alowooza obubi atandika okulowooza ebintu ebigenda omutwala ki emmaaso. N'omuganda naye kati onoobeera nga weebase omwana ono tagenda ozza kwetaaga so ngeri omubuulira naye nga tomujajinga, do not judge. Wagamba nti amanyi ng'alina naye mbadde sisobola bwentyo omugamba omuzzaamu buzza ki maanyi. Then n'engeri endala omukyuse enneeyisa ye woba babadde akugambye nti omanyi kati saagala kubeera mu bantu fuba okulaba ng'omuleetera abantu akyuse mu nneeyisaayo omuyambeko. Then n'ekirala abaami bababe nga babategeera nti omukyala waazaala abamu bakyuka naturally bakyuka. Bw'aba akyuse n'omulaba bw'oti ate gwe tokambuwala akola kikakkana. Then engeri endala tulina n'okuba kansolinga n'okubazzaamu essuubi kitwayita counseling and reassurance psychologically. Nti omuntu ono omuzzaamu essuubi n'omugamba ensi tekoma kati ensi ekyeyongerayo ate afudde oba tolina kyogenda mukola naye bw'akyali omulamu olina ky'osobola okukyusa mu mbeera eno. So n'okagamba obeera nga amuzzaamu ki essuubi kitegeera. Then ekirala eddagala we lijjiramu singa biri byonna tubikoze byonna ne tulaba nga mu butuufu kikoze eki kigaanye. After doing all the supportive counseling, psychological reassurance, psychoeducating, supportive therapy, and also psychotherapy, after all that has been done and nothing has changed, the patient is really still what? Depressed and really what? Sad. That's when we come in and maybe we start using some drugs, but we start with the low doses. With the high doses, we start with low doses. For example, we can use what we call antidepressants. Antidepressants are njawulo. Mje tusobola kutandika nayo tusobola kutandika fluoxetine yali common. Abantu abasinga bamumanyi. Fluoxetine ono akuyamba okuba nti omuntu abadde afunye ennyiike eyo. Atandika okukkakkana era eddagala lino tutera ddiwa nnyo ku makya. Then ennyiike n'adde n'okwerabira abamu abantu abalina postpartum depression n'adde n'okwerabidde akabonero nako batera okukafuna. Mu nsonyi naye kabagambe abamu batera okufuna omutwe nga gumuluma nnyo naye nga teguwona tetuyita persistent migraine headache. Kati lino eddagala waliyo ka imapramine ono oba amitriptyline. Eddagala lino likola engeri ki?
Musawo Brian, olw'okwewala abantu okwewa eddagala nja kusaba olw'okwewala abantu okwewa eddagala nja kusaba oleme kwogera ddagala wano kuba bagenda kudduka mu famasi ate batandika okwejjanjaba. Yes.
kale
Eddagala bajja lifuna
kati
nga
tulina
bazze
eddagala
mu
libayita
ddwaliro.
tulina antidepressants tusobola okuzibawa, tusobola okubawa zi mood stabilizers, omuntu n'abeera nga tagwayo nnyo eri. Tusobola okubawa amadagala gaba ganjawulo ge tusobola okuwa muntu akisinziira ku bubonero ki bw'aba azze nabo. Kitegedde? Kyekyo.
Again,
So ziri
to everyone,
n'ekirala kye tulina okukola, abantu bano beetaaga support, also from the husband.
Yes,
So support
Mr. Brian.
beetaaga nnyo.
Mr. Brian, actually, at that point, how can partners and the community support these struggling mothers?
Tulina kye bayita family counseling, like counseling the two partners before conceiving. They should be counseled on when they are ready to have the child, because singa kigwa bugwi tugenda kufuna embeera eno, omuntu ajja akuzaala agambe nze omwana naye simwetegekedde. So singa kyandibadde kikulu nnyo ne tubanga family bagikwansolinga the two partners, kuba abazadde bayinza kujjamu luvannyuma, naye bano abantu ababiri balina okusooka ne babeera nga bakoze batya, nga bababuuliridde ate nga babategese. Ekyandisinze nti embeera eno weeba ezze kiba tikyekango kwegamba omuntu aba yakisuubira, nti bwe kiba kizze omuntu olwedde amanyi n'owokutandikira agamba naye baŋŋambako akantu kano kiyinza okubeerawo. So omuntu olwedde abeera ati abeera amanyi ekiddako n'ekyokukola. Omuntu eyandibadde abuguka obubugusa oba okubuluugutana oba okwekanga obwekanza ekintu kyonna, abeera mukkakkamu n'amanya ki kyakukola. Then bw'alaba ng'asobeddwa n'amanya okugenda okukola ky'okufuna obuyambi, okugeza mu ddwaliro, abantu, then mu community abantu bababuulirire nti ebizibu bino bibeerayo. Then n'ekirala mu community wolaba ng'omuntu talina buzibu, muyambe omutwale ewantu wasobola okufuna ki obujjanjabi oba obubudamu oba obuyambi. Then mu community twandibadde nnyo nga twemphasizinga nnyo kyaki, amasomero abaana bababuulire, ku university mu bufunze tukole mass education. Ekitegeera, let's educate the community about what is going through, and abantu bababuulire where to go when they need help.
Again, actually, Oyogede, you've talked about a very important aspect of mass education. I feel there is something actually that the Ministry of Health should work with the Ministry of Education. I feel that in A-level or in all universities, in all courses across, whether you're doing medical or not, there is some basic information that we should equip all girls with. When we were growing up, to our mothers who went to these so-called traditional schools, there were sessions where all girls would be taught basic things. How do you take care of a child? How do you bathe a child? What are signs of pregnancy? So a girl left secondary school knowing some of those things. Now, I believe that some of actually these things like postpartum depression should be mandatory, that every woman attending any course at university at least are told that, when you give birth, you may expect such and such and such condition. When you give birth, such that every woman that is going to get pregnant at any level, at least there are basic things they know. Today we are having women who are educated at even getting pregnant, but they even don't know the signs of pregnancy. But they are educated, they did a research, and even they have a graduation gown in their house, but they have no knowledge about basic things. Yes, Brian.
Yes, masomero bayinza okugendayo ku radio ne baogera, naye biseera ebyo abantu bayinza obutabiwa nnyo budde. Ekyandikoleddwa, mukyala yenna yenna bandibabuuliridde on the first day on antenatal.
Okay.
They tell them before conceiving they should go and attend what we call the pre-antenatal care. The pre-antenatal care, it's like you are preparing the couple on what's going to it's like you are giving them a light of what will happen, what might happen. You get, yeah? Nature on these antenatal visits, abantu babeera nga bababuulira nti you might become this or you might face this, such that they are aware, such that bwe kiba kizze muntu abeera jjo kuba ku university kiyinza ogenda but very few pay attention to it.
Yeah.
Kiringa nga gwe onoobeera nga enjala ekuluma but you are around some other people, no one will notice that you are hungry until gwe kuba bomu bajja kulowooza mwena muli bakufu. Ekitegeera naye kati you single out yourself nga gwe, you single out yourself nga gwe noga nti so kati mu masomero mbagambe nti baba batuuse okufumbirigana, they should go and visit health personnel for more information. You encourage these young couples to go normally visit the healthy professionals for more information. Karate continental, during those antenatal visits, let us educate. Let us encourage the couple omuchala encourage about these hospitals, whichever where you are attending your antenatal from. Encourage the couple ever to come twice too, like the man and a woman, such that omwana ajja tetugenda kufuna ekyo, but when we encourage the couple to come to be of benefit, because everyone will be taught and they will learn.
Okay.
N'anaaba nga takitaddeeko nnyo, but whenever this thing happens, at least anaabeerako with some knowledge that baatubuulirira kiduli eri kino ne kijja ne kino kizze, at least they will be with some kind of knowledge.
Okay. But also, actually, Brian, thank you so much for bringing that aspect. I think Sister Banula Gertrude Abali Antenatal are watching in live, and these are some of the important things that they should be actually teaching our women in antenatal. But also, number two, Brian, I think these churches and mosques where we get married from, abantu bagenda for premarital counseling. Nayo batandika okuyita people like Mr. Kasozi to come and talk about postpartum depression, because we are sure that after marriage, these couples are going to have children, and most of them, it is their first child. So we should use all avenues. Church ngawe musaba things like mulete simanyi testing certificate. Let us start to involve medical workers in this counseling, because bintu bingi talk about genetic diseases, talk about some of the things they should check out for. I think we should also have a session, a healthcare session among those sessions, the premarital counseling session, where at least a woman, at least who didn't have this information, at least ingaze mu church oba muzikiti. I don't know when muzikiti eberayo premarital counseling, I will be corrected. At least in church, I'm sure. At least one of those sessions or two of them should be about medical things. And I think these are things that we should actually teach about. But also, I want to encourage more psychiatric clinical officers, Mr. Brian, to use these available spaces to come out and speak about these diseases. Mwekweka nnyo Mr. Brian, mumulowooza olw'okuba endwadde za mutwe tujja banoonya. Bannange naffe mutunoonyeeko. Naffe mutunoonyeeko.
Ebintu bya ssente kuba kati obeera onoonya ssente sente zaabula.
Okay, Mr. Brian. Mr. Brian, as we finish here.
Besides that, let me tell you.
Yes.
If there are many issues, I was just having a joke. But the truth is,
yes.
Abantu tebalabika because naffe tulina avenues kuba katukoma mu ddwaliro mukka so-called avenue. Oba ogenze wala people baagala ssente okubawo ate nga like you want to deliver them, but they still want money from you. They
yes.
don't know that the information you are going to disseminate to them is more important than the money. Don't we need money? Go get mazima. Yeah, we need the money. Bakatola example jengendo okuwa yenu.
Twagala ssente.
No, sente tuzeetaaga naye ate tuzeetaaga go ge mazima nze sijja kulima I need the money. Money is part of everything. Let me tell you, when you don't have money, even you can become mentally sick. You can become
Exactly.
depressed. The things that we are talking on here. When you
Mm.
have no money, you can't do anything. By the way, you feel small among your friends. You feel
Mm.
like even you can't associate. So let
Mm.
me tell you, finances can cause mental illness in the family because now it can also cause family breakup. I am aware of that. When you don't have money,
Mm.
can you go and attend antenatal? You cannot. You cannot deliver
Yeah.
from good places. So everything needs money. But besides that, people are
Mm.
still ignorant about mental illness. They don't think people still have a belief that these mental illness conditions are just witchcraft.
Witchcraft.
Yeah,
Mm.
so people have that kind of knowledge gap. That
Mm.
if someone, for example, if someone is born with epilepsy, that those people are born with the bad omens. You get,
Mm.
there are curses in the family. Yet it's a condition. You get,
Um,
and
okay.
also we also
M-
face the challenge of this. There are very few. There are very
okay.
few clinical
Okay.
officers in the
Yes.
country.
Mr. Brian, as
Yes.
we conclude this wonderful discussion, again, I want to remind people watching in that this is a discussion on postpartum depression. And I believe all of you have come across that family that almost lost the connection after having a child. The woman became aggressive. The woman started neglecting herself or neglecting the child or neglecting the husband. And many times the husband feel neglected. They want to assume their position in the family. They now are treated like foreigners or invaders in their own home. Some of them because they are traditional men, they are going to use physical mean to ngenda mukuba paka wanampe ekitiibwa kye yali ampa and things like that. I'm going to beat up until she respects me again. Some of them go on to have side chicks or outside partners because they feel at home. Omukazi, once she gave birth, she has now all the love turned to her child. I want to teach everyone watching in that this is not her own making. She's sick. She needs help. And to all women watching in, if you realize your fellow woman changed the way she was treating her husband or the way she used to be happy, now she's not happy ever since she had that child, it is not because she became mean. It's not because she's showing off. It is simply because she's having a mental issue and she needs help. And until we speak about these things so many times, that's the only way we can change the community. That's the only way we can change the environment. There are some women that have given birth and they hate their children. They don't want to breastfeed them. The child cries the whole day and she's only watching movies. Some of them have got to an extent of abandoning their child. Nazaala omwana n'amutwala mu kyalo n'amulekera maama oba n'amutwala mu orphanages oba n'amusuulawo. Don't judge them. They are mentally sick. They need help. They are not mad people. Si balalu. They are just going through a wave of enyike or they are being depressed. We need to be a community that supports other women to stand up. Mr. Brian, again, as we conclude, there is now a mother watching this program and she's going through all the symptoms that you've said. But maybe she cannot get to you to Rubaga Hospital or she cannot actually go to a clinic. What do mothers, what are some practical things can they do at home? But also, what can mothers do at home to protect their mental health? To make sure they don't get postpartum depression or to make sure even when it comes, it does not affect them that much.
As I said, postpartum depression normally happens in mothers after giving birth. Yeah?
Yes.
So now, I think they should before giving birth, they
Mm,
should they should sit down with their partners and decide on
mm,
when to have the children or the child,
mm,
because these unplanned pregnancies normally can lead to that. Then,
mm,
besides these uncertainties, for example, loss of a job, loss of a beloved one, you should
mm,
also seek guidance from care providers.
mm,
For example, people should have family support. They should be
mm,
in touch with their families. They
mm,
should not stay. They should also report or any sign that they feel like someone should feel free to express herself freely. Because
mm,
when someone has this low self-esteem, someone is going to isolate from the rest. But people should have that self-confidence in them that me, whenever I get a problem, there are people to
mm,
reach out. People should learn to share problems.
mm,
Because a problem can never be shared alone, but when once you have someone besides you, people should have their best friends. At least you should
mm,
have that someone you can go and talk to. You know what, dear, I'm going through a certain challenges, and the challenge can be solved because you can't solve it alone. No,
mm,
no man is an island, so we need to live together. Then another thing is self-care. Self-care
mm,
is very important. You should eat well. You should do some exercises. You should love yourself, by the way. No one will love you better than yourself. You should love
mm.
yourself as the first point. You should care more about your life. I think those are the few things that maybe I can talk of.
Mr. Brian, as we conclude this episode today, and again, if you're watching
Mm.
there and you have any question for Mr. Kasozi before we leave, please put it in the comment section. Mr. Brian, what would be your closing remarks for this topic? And which advice can you give to all mothers that are going through this kind of postpartum depression? But before you answer that, Mr. Kasozi, is nutrition, rest, anywhere important during recovery?
Nutrition,
Is there a
yeah,
connection
like
between
I said,
nutrition?
under self-care.
Mm,
Self-care, it involves a lot. I've talked of diet.
okay.
I've told of loving yourself, doing exercise. You can't do exercise when you are not eating well.
Mm,
You get. You
yes.
must eat a balanced diet is good because it will help you to have a well. Even when you are eating a delicious meal, I think you eat it with a lot of joy. Not so. Can you eat
Yes.
something that is you don't like and you don't feel like you are eating, but you have to you not be happy at the what? You not feel happy. But when you are eating a delicious meal, my dear, you eat it with a lot of joy, with a lot of happiness. Have to be doing. You get. So
Yes.
a nutritious diet is now, as I'm closing, as you had told me, postpartum
Mm,
mothers should know, or before conceiving, they should ensure that they are attending what antenatals, and in antenatal care or centers, these mothers should be educated or should be given some light about what they should expect. They should not
mm,
expect only good things, but also bad things to come on their way when they are giving
mm,
after what? After birth. Because these mothers expect much. They should not expect only good things after giving, but they should
mm,
also be aware of some uncertainties after giving
mm,
birth. And another thing is that when the thing comes, they should seek for help because this thing
mm,
does for it to happen. It starts with one symptom. Someone will ever
mm,
feel sad. Get. So when that symptom comes, you should get worried and become what and come into like you should seek help. You like if you have your husband, you should sit
mm,
down and tell him that I'm not feeling well.
mm,
If this husband is understanding, we also seek what professional knowledge from health providers, and I would
mm,
encourage mothers ever to have their deliveries in healthcare settings. They
mm,
should encourage these settings. They should be couple counseling, psychological
mm,
support from both the families, from both the father's side as well as the girl's side. They should have support from either sides.
mm.
Yes.
Mr. Brian, if someone is interested in having your service or coming to Rubaga to meet you, how can they get you?
Of course, when you come to Lubaga, it is the hospital, they will direct you to the hospital. And by the way, I'm not alone. We also have colleagues, which is a group of, it is a team of people,
Yes.
professionals. We have psychiatric nurses, clinical psychiatry, we have psychiatrists, we have psychologists, we have occupationals. We have, it's a group of, it's a team of professionals under mental health. So when you come to hospital like Lubaga, I think you will be served by different personnel. And I think we will do the best to ensure that maybe you get the best services from our team. And
Uh,
personally, me, I'm called Kasozi Brian, as I said earlier. Currently, I'm
would
at Lubaga Hospital.
would you mind sharing your contact for in case anyone would love to have it?
Oh, it is 070. Sorry, it is 070 554 1647. That's a WhatsApp number as well.
Okay. Please send regards to, as we close, to your friends in Iluvaga Hospital, your dear wife and family, and everyone, and we shall call it a day after that.
Yeah. Njja kwebaza buli abaddeko kuva gye twatandikidde bye tusomye na paka wano we tutuuse bannaye, mbaaniriza nnyo era nnyongera okubeebaza bane mwebale tugoberera. Era nsigadde amanya nga nze Kasozi Brian, nja kutumirako mukyala wange, nze ndi musajja mufumbo, mukyala wange mukyala Inidi, ninayo omwana wange omu, tunyumirwa. N'ekirala banaye mujje luba ddala, n'ekirala buli muntu yenna yenna afuna ene challenge mentally. Si buli muguwadda sorry okukozesa ekigambo ekyo, si buli muntu nti ayina obuzibu ne bankyogere ntya mu Luganda. Not everyone that has a mental challenge is mentally sick, but it could be a mental challenge everyone can face. For example, stress is stress lives within us or around us. So whenever someone is stressed, we would encourage at least to come and we have a talk or a chat. It's good to visit a health professional, more so in mental health. Oyinza okusanga nga you a medical officer, but again you are also having these challenges. Manyi waliwo abasawo abagamba nze ndi musawo ate ngenda ntya ew'omusawo, so ndowooza waliwo bafunyeeko abo mukulu. Olina kugamba nze ndi kengeze amwesajjoni, ekitegeera. Ye nagamba nti kati ate ngenda ntya ewa psychiatrist, okiraba kino tekikwatagana. So olaba nti no oli ayinza okugamba nti ate ngende ew'omusawo munnange aŋŋambye nti ndi mulwadde wa mutwe, naye nga zino endwadde z'emitwe za njawulo, zirimu n'emitendera. Wali abafuna obuzibu ayinza n'okubeera, for example, oli ayinza okugamba nti nze nseebaka, naye olina omugamba nti no okimanyi nti no obulwadde bwa mutwe n'awakana naye. Endwadde z'emitwe za njawulo, so twandikubiriza abantu bajje mu ddwaliro bafune obukugu buno n'obuyambi. Obuyambi bubeerawo, ate naffe tubeerawo 24 tubeerawo 24 hours, eddwaliro liba ggule nga tujja baaniriza. So ab'erubaga ababadde kuno bannaye mbaaniriza era nja nsanyuse nnyo okwogerako gye muli. Naawe omwami abadde atuhositinga naawe nkwaniriza nkwebazizza, nonsonyiwa Oluganda nfunamu obuzibu zo nti ndi Muganda, temunfuna bubi naye ebyo bibaawo. Nsanyuse nnyo bw'atwaniriza kuno ku mukutu, buli kimu tweyanziza abanaye, era nsanyuse nnyo okugabanako akatono ako nammwe. Tunayongereza okwo bingi nnyo bye nsuubira okuba nga tugabana ffenna, era nga mbaagaliza Omukama abeere nammwe.
Again, Mr. Brian, thank you so much for accepting to be here. We often celebrate the birth of a child, but we forget always to check on the mother's postpartum depression. Postpartum depression is real. This does not mean that the mother is weak. No. It simply means the mother is human and she needs every support. The relevance of this program today was to create awareness, was to prepare an environment where every mother feels seen, feels safe, every mother is heard and understood. Me and you know a family that almost lost the relationship or that almost broke up simply because they had a child and the mother experienced untreated postpartum depression that was not managed. If you haven't met that family, soon you're going to have one, or it could even be in your family. It is your responsibility and mine to make sure we create awareness about postpartum depression. We've seen mothers that give birth to children and they don't want them. They don't want to look at their child. They hate their children. They hate their husbands. At first, it is baby blues, like the expert explained it, but later it can turn into postpartum depression. Today, we've looked at the symptoms, the signs, the probable causes, the management, and how we can support these mothers. Remember, if you know or you are someone that is struggling with postpartum depression, please seek help. Your mental health matters. Together, we can create a society that is safe for all mothers, that is supportive. If you're a man like me or a husband, and you notice any changes in the behavior, in the attitude, or in the reception from your wife after giving birth, please be considerate and supportive. Do not neglect them. Do not leave them, but just understand them. Again, thank you so much for watching Mr. Self-Care today. This episode was specifically on postpartum depression. If you found this conversation helpful, please like, comment, and share to support mothers who may be silently struggling or not knowing exactly what's happening with them. Again, don't forget to subscribe to Mr. Self-Care Health channel on all platforms, that is YouTube, Facebook, TikTok, X, for more powerful healthcare talks that educate, inspire, and transform life. Again, my name is Mr. Self-Care. Thank you so much for being here today. I wish you a very blessed Sunday from our studio in the US and all our coordinators in the different parts of the world. Have yourself a blessed Sunday. God bless you. Bye.